Thank you, colleagues, for this invitation. It's a great honor to be spending this time on International Women's Day with you all. And of course, as you've said, that I'm the current mandate holder for the right to health. And of course, being an important role, I think, because of the definition of the right to health, which doesn't only speak to timely or appropriate health care, but also speaks directly to the underlying determinants of health. And these are quite important, especially when we're talking about sexual and reproductive health, as well as the rights concerned, because we know that many a times there's a lot of abuses and violations that happen around sexual and reproductive health. And many of these are long-term. The consequences remain with us, past the trauma or the incident. And I think what's really important, again, is talk about, the right to health, including actually the right to access health-related education and information, including on sexual and reproductive health. And we know in many contexts around the world, there's a lot of monitoring, there's a lot of censoring around sexual and reproductive health related education, as well as information. And those restrictions are actually a form of human rights violation, because we know in order to make informed decisions, about one's treatment, after a particular diagnosis, to provide informed consent for particular medical intervention, one needs to get access to information in order to actually give informed consent. And, in terms of the International Covenant on Economic, Social, and Cultural Rights, states have particular responsibilities and obligations in terms of the right to health. And these are important, and they are defined in General Comment number 14 in order for them to fulfill, in order to implement the right to health at the national level. And we know that one of the important obligations are to respect the right to health. And this includes refraining from denying or limiting equal access of all persons, from preventative, curative, and palliative health, and also refraining from enforcing discriminatory practices as a state policy. And this is important because it speaks further that states have an obligation to respect the right to health by abstaining from imposing discriminatory practices relating to women's health status as well as needs. The second obligation is to protect. The state has a duty to protect by adopting legislation or taking measures ensuring equal access to healthcare and health-related services. And this includes services provided by third parties. In many governments around the world, especially in the so-called Global South, the developing contexts, a lot of healthcare information and health-related services are outsourced to third parties. And the state has an obligation to actually ensure that third parties do not violate the right to health or limit people's access to health-related information and services, I think, which is really key. The third obligation is to fulfill the right to health by giving sufficient recognition to the right to health in national political and legal systems. I think this is key because we do have a lot of member states who still don't recognize fully the right to health in their national political and legal systems. And it's important that they do this by a way of legislative implementation. They need to adopt a national health policy that is detailed in planning around the realization of the right to health. And this is important to also remember that the obligation to fulfill the right to health entails the state having to take positive measures that enable and assist individuals and communities to enjoy the right to health. And that's just the introduction and the background of why this work is so important and why human rights as a framework is key for us to protect, firstly, the right to health, but more specifically, sexual and reproductive rights, as well as sexual and reproductive health and all of the services that are contained in there. And of course, over the years, there's been binding human rights treaties, jurisprudence, and consensus outcome documents of international conferences that have shed light on the content of what it means around sexual and reproductive health rights. And in essence, sexual and reproductive health includes the right to pleasurable, satisfying, and safe sex life that is free from discrimination, coercion, and violence. And this is important for many of us, regardless of where you are in the world. The threat of violence, the continuous experiencing of violence actually impedes us from having satisfying, pleasurable experiences as women. Is my time up already? Okay, I'll just wrap up and say that it's important to also remember that sexual reproductive rights are grounded in the right to life, the right to dignity, to education and information, but also to equality before the law and non-discrimination. It's important to also remember the right to privacy, right? The right to freedom of opinion and expression about one's body, about one's treatment, about one's gender expression and sexual expression as well. And I think, again, just in closing, to say that we have a right to be free from gender-based violence, harmful practices, torture, and ill treatment. And ultimately, the right to health is an important right that enables us to actually protect and fulfill many other important human rights, including the Sustainable Development Goals. Thank you so much.